So it's 4:58 in the morning and I look really good surgery day, but I guess you don't have to look pretty on surgery day. So I just finished washing my hair with this thing. It's the second time, and holy man, does it strip everything. My hair feels like straw, like literally, like ugh. It takes everything out of your hair except the color. Haha. So I'm still pretty good. Should be okay for another week or two. I don't think you can color your hair for 3 weeks, so might have to go gray or use some tween time in between, but I'm not the least bit nervous this morning, which is kind of funny. So I better hurry up and get my hair braided, and we have to be there by 5:30, so better get a move on. Yeah, I'm sitting in the pre-op room with my gown and my toasty warm blanket. I could go to sleep. And the funniest thing, they said my armband that they told me I couldn't take off is expired. Pretty funny. Hi everyone, I just wanted to come visually online and say a big huge thank you to all of you who had prayers for me and Deanne for our surgery this week. It was a crazy week. We were also worried that it wouldn't work out, but with your prayers and support, everything went great. So thank you so much. I am 4 days post-op, and she is 2 days post-op, and everyone's been helping out and doing everything they can, and it's been going really well. I'm still having some pain. It's getting better though, and I have a lot of hearing loss in this ear, but they said it was very temporary. And then for 3 days all I could hear was shoo, 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 shoo in this ear, but that's gone now, so who knows, it'll all come back to normal. I've got that new cute buzz haircut, you know, where there's shaved on the bottom and a little bit of hair on the sides. Kind of funny. But most importantly, surgery is done. Hi everyone, it's Monday. It is 6 days post-op. And excuse my face. I was going to put a little bit of makeup on, but I'm like, I don't have enough energy. By the time I got my house coat on, brush my teeth, you know, I want to go back to bed. So I just wanted to give you guys a little bit of an update and tell you a little bit of my story about my surgery now that I'm a little bit more lucid. So you all know I went in on Tuesday for my MVD, microvascular decompression of the trigeminal nerve over here. And I'll give you an updated look at the scar. It doesn't look bad. It's actually coming along quite healthy. I hope I have it in the right place. Anyway, so the Dr. Finley went in. It was so funny because I'm in the operating room and I'm like chatting away, you know, hi, how are you, blah, 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 with all the nurses and everything. And then I'm like, aren't you guys putting an IV in? Because obviously that's how they put you to sleep. And so then he said, yes, I'll put the IV in. And he froze my hand before he put the IV in, which I thought was just genius because you don't feel the IV. And the freezing needle is such a teeny little, like a mosquito bite. And so he froze the hand, put the IV in, and then I see this brown tea-like looking substance about to go into the IV. So I said to the nurse, are you guys like starting this already? Like, is this like, are we starting now? Or is this like a rehearsal? Or like someone gonna tell me what the heck? So she goes, well, just I'm gonna put this mask on your face. I just want you to relax. There was no counting backwards, 99, 98, none of that. So then she says, are you getting relaxed yet? And I'm like, nope. Under the mask, nope, not at all. I could still chat for another. Gone. So the next thing I remember, I woke up with the most excruciating headache I have ever had in my life. A migraine on top of neck pain. It was horrible. Like I've had a lot of surgery. I've had surgery. I know what post-surgery pain feels like. I was actually crying out loud, like, my head, my head, my head. You know, how crazy you act. So they had to get me moved back into ICU and get you moved where you're supposed to be before they can obviously get you all comfy and settled. And my ear, this ear is plugged. And apparently that's temporary. And at the first 3 days, it was going shh, 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 which was very annoying. But that's stopped now. And now it's just really, really plugged. So those are kind of post-op things that will eventually go away. And the hard part for me through this whole thing was managing my pain, which is kind of funny because you think somebody who is on painkillers regularly would know how to manage their pain, which is why I came home early, because I felt I could do it better. They had no clue once I got out of ICU. It was a zoo. And I think it's because when you're already on painkillers, your doses are totally different. You have to find the right dose that isn't lethal but is strong enough to get rid of pain from somebody who's kind of immune to painkillers. So that's what I spent a lot of time trying to adjust, but I think I've got it right now. So anyway, stayed in ICU for until Wednesday afternoon. Wow, you just need one day in ICU and being alert enough that you can hear what's going on. You there but go the grace of God go I. There was a woman, she was 21 weeks pregnant, and she had an aneurysm. There was another lady who had an aneurysm. There was a young man who had hit something, and it was really interesting. They had like a PA system, and they were talking to the paramedics at the site who are working on him, and then they were also getting everything ready for him. So by the time they got him to ICU, he had already had treatment, which was incredible. There was a young person that died. It's just crazy. So I was the best of the gang in there. And my doctor came in, and somebody, if I can find the picture, I'll stick it in right here. But somebody in the OR, I went in with my 2 usual braids. Someone in the OR undid the braid, put one here, stuck it up here like this, and put a green elastic on the end. I'm like, really? And then he told me they were Googling my dad in the OR because the anesthetist didn't know who he was, and so they're Googling my father. So I guess my dad was with me during surgery, which was kind of cool. And what other things did he say? It just sounded like it was a very casual, not difficult surgery. Although he did say he found something completely not what he was expecting. What he was expecting to see was an artery pressed against the trigeminal nerve. That's the typical, like this. An artery and the nerve, like this. And they put a Teflon or some kind of pad in between, like that, to separate the two so there's no pressure anymore on that nerve. What he found instead, he said, was one of the biggest blood vessels he has ever seen. So they had to take pictures because it was so big. So for teaching, so he said, yeah, we're taking pictures of your brain. I'm like, pretty. And so he said the vein was as big or bigger than an artery, which is very unusual, but the wall of a vein is not as strong as the wall of an artery. So they had to clip the vein. It's almost like do a bypass, I guess, of the vein. I'm not sure. He'll have to explain it to me when I'm more coherent, but I'm pretty sure that's what it is. They clip the vein so there's no more blood flowing that way. And then I think they still put that pad thing in there. And so he was just kind of like, please let me know if you feel any more trigeminal pain. And there's a couple of days I felt pain, and I think it's that, but I think it's surgery pain because it's so close. I mean, my ear hurts, up in here hurts, and I mean, the trigeminal pain is here, so it's kind of hard to tell, you know? So, yeah, so I said, well, thank you so much. He goes, don't thank me yet. I'm just not sure. The jury is out on this one. So I'm like, Don't tell me that now. But anyway, it is what it is, you know. So the hardest part, I feel like I'm slowly recovering, but I guess it's only 6 days after brain surgery, and I've been walking around. But the problem is I'm so clumsy. Like I just walked into Richard's room down there and I knocked a picture off the wall. And I can't, you're not supposed to bend down. So there's things on the floor. This is Richard's first day gone to work. So it's about 9 o'clock in the morning. So this is my very first day, just me and my mom. My mom has been a huge, huge help. We were kind of worried about her because, you know, she has slight dementia. And she's just been wonderful. She's been like a mommy. She's been tucking me in, bringing me drinks, bringing me lunch. Just, I couldn't have done it without her. And it's just, I'm so glad that because we were kind of worried, what's she going to do? How's she going to be? You know, like all that kind of stuff. And she's been, I couldn't have done it without her. So that is so nice. So, that was the best thing of all. I was like, oh, there's my mommy. Come and give me hugs and kisses. And Deanne's doing great. She's coming home. She's coming over today. So we're just going to lie in bed and order pizza and just have girls' day. I haven't seen her since Wednesday. We see each other, except for when she was away at university, we saw each other every day. So this is like I'm going through mommy withdrawal. Teresa's in Mexico. Janet's gone. And all of you guys don't live close to me. So yeah, I'm going through all these withdrawals. But try not to feel sorry for myself. I'm fine, you know. Lots of family, lots of other really dear friends. Lori, Laura, like lots of friends. I mean, I'm not lacking for attention. But you know what I mean. It's like your people, especially Deanne, like she's not here. And so these things on my forehead are not zits. There's one there and one right there. See that? And there's another one somewhere over here and somewhere in the back. I think they go all the way around. That's where they screwed the halo into your head. So they put you to sleep and then they put, you know how you've seen those people with those halos on their shoulders. But anyway, those are the screw holes. And they actually, this one especially, this one's not so bad, but this one feels like somebody screwed something in your head, you know? It's so gruesome, isn't it? But it's amazing at the same time. My son-in-law, Brody, he is so funny. He's like, did they actually drill into your brain? I'm like, Brody, yes. How else do you think they got in there? He goes, but they took a drill into your brain? I'm like, yep. It's like ice fishing. They cut out a hole, pulled it out, took the dura, the layer of the brain, and exposed the brain. That's what they did. He's like, wow. He's just so funny. But this isn't my first surgery with drilling and sawing and cutting. The first time it was when they did my spine and they went in through this scar. You guys have seen this scar a bazillion times. And they cut out C5, C6, the disc there, removed it. They had to saw it, hammer, cut. Sounded like a construction site apparently. And put cadaver bone in replace of it and then let the bones fuse together. So in theory, I think the spinal one was probably more dangerous as far as coming out paralyzed. If something went wrong, you'd be paralyzed from the neck down. So this one, oh my God, they kept asking the same thing. What's your name? Monica Lipscomb. Where are you? In the ICU at the University Hospital. What's the date today? And I'd be like, well, what time is it? And they'd tell me, it's March 11th, 2014. And then they'd ask me one other thing. But then I realized as I was coming more out of it, the lady beside me, they kept, you know, they ask all of us the same thing. Within a half an hour, she went from being able to answer to crashing and becoming critical and non-responsive. I'm like, whoa. Now I see why they do that. Because your brain can change so much. So this is all I'm going to videotape for right now because I'm feeling really nauseous and that wouldn't be pretty on camera. You see me keep touching my face. My lips are so dry and I need some, you know, lip balm on them. But most importantly, I just want to say to you guys, thank you. Thank you, thank you from the bottom of my heart for all of your thoughts, your prayers, your notes, your emails, your texts. Oh my God, you're so sweet. I was just reading those and combing through those the night before my surgery, and they just give you so much. It's like the world, your YouTube, Facebook family is lifting you up and holding you, so you don't have to worry about anything. It's just, it's an amazing, amazing thing, and I just love you all from the bottom of my heart. I really, really do. So I'm going to go for today, and I'll do another update in a couple of days. Bye.